Well, good evening, everyone. It's a pleasure to be here with you tonight. My name is Rob Glass. I'm the superintendent here in Eastchester School District, and I'm delighted to be joined by some co-hosts, some of our board members who are here tonight. I'd like to introduce them. Judah Holstein is here with us. Dr. Cheryl Smith is here with us tonight. I think we're expecting also Dave Caforo to be coming along any minute, so he'll probably be joining us. And again, these board members will be working with us tonight to host a session that is dealing with the health procedures for the reopening of schools starting September 10th. And we have taken all of your questions and that you've submitted already, and those questions have been worked into a PowerPoint, which our key presenters will go through tonight. And we will then continue the discussion, taking additional questions that you may have through the chat feature, which is located here in the Zoom program down at the bottom. If you hover there, you'll see chat. You can submit a question, and our co-hosts will be gathering those questions and posing them to our presenters. It's my pleasure to introduce our presenters tonight. Assistant Superintendent for Pupil Personnel Services, Dr. Noreen Urso, will be our featured presenter tonight. We have our district's medical director, Dr. Rebecca Collins, here with us tonight, joining us. Thank you for joining us, Doctor. And our school nurse, Catherine Sullivan, who is also going to field questions and be part of this discussion. So thank you for giving of your valuable time. Thank you to our community for giving of your valuable time. This is the fourth of 8 sessions, at least 8 sessions that we're planning to have. We've already had sessions on facilities and transportation, on hybrid teaching and learning, one for Eastchester Middle School. We're planning one for all of the schools that will be next week. Additional sessions are coming up. We'll have on the 25th, Wednesday, this coming Wednesday at 11 a.m., we're going to finish up the transportation portion of that original survey. That was knocked out by a power outage. We never got to finish that session, so we're going to do that Wednesday at 11. Also, Waverly will have a session on the 25th at 4 p.m. and Hutch on the 26th of August at 4 p.m. Greenvale on the 27th at 4 p.m. and the high school also on the 27th, but at 7 p.m. So that will round out our presentations we have planned thus far. These are being recorded. They are posted on our website, www.EUFSDK12.org. You'll find robust Q&A. You'll find recorded sessions, previous sessions. You'll find links to future sessions and everything generally that you need there. And so I would direct you to go there. We're trying to make that your one-stop shopping place. So with that, I'm anxious to get started, and let's toss it over to Dr. Urso. Take it away.
Okay, great. So again, thank you all for coming to this virtual session on health procedures. And I just want to welcome everyone. What we're going to be doing this evening is we're going to be going through some PowerPoint slides. I did take a look at all of the questions that came in, and we incorporated a lot of the questions into these slides. I do have a few questions at the end that were sort of outside of the information. So we're going to try to cover as much ground as possible. And I just wanted to thank in advance Dr. Collins and Catherine Sullivan for joining us this evening, because your input is invaluable and it has been through this process. So I'm going to share my screen. Okay, did that work? Okay, great. So I just wanted to start with that the information for this evening's presentation has been derived from a lot of different resources. Obviously, the Centers for Disease and Prevention, the CDC, the New York State Department of Health, the Westchester County Department of Health, the New York State Education Department, and the Eastchester reentry plan for the fall. So lots of great organizations and lots of information to kind of cross-reference and go through. We wanted to start with Dr. Collins to really kind of talk about COVID-19 symptoms and, more importantly, prevention. We're really going to focus on prevention, how we can all work together as a school community to really, help each other out in this process, keep kids and staff and everyone safe, and keep schools open. So Dr. Collins, I'm going to give it over to you to start it off.
Okay, great. So COVID-19, coronavirus is kind of why we're doing all these extra measures, yeah. And though it's a little unfortunate to be in the middle of a pandemic, I think overall it presents a really unique opportunity to increase our infectious disease procedures overall. So a little bit of background, coronavirus, as you hear it called, COVID-19, is an illness that's caused by a virus spread person to person. It's new, a new coronavirus that we identified at the end of last year, hence the 2019, and it spread throughout the world. And the symptoms can range from mild or no symptoms at all to very severe illness. Here you'll see some pictures from the CDC kind of outlining those symptoms, right? So fever, chills, cough, shortness of breath, difficulty breathing, muscle or body aches, vomiting, diarrhea, new loss of taste or smell, fatigue, headache, and any degree of those, from a mild illness to something severe that is life-threatening. One thing before we advance, anytime you see the hyperlink, I've included the references to where I've gotten the information. So you can click on that to go to the CDC website and various other sites that I've compiled for the presentation. So prevention. So number one, the best way to prevent this illness is to avoid being exposed, right? So we talked about how COVID-19 is spread from person to person through close contacts and through respiratory droplets. So what can we do to keep ourselves safe? The first is to wash your hands often, washing hands for at least 20 seconds, using a hand sanitizer that is at least 60% alcohol, and avoid touching your eyes, nose, and mouth. That's a big one, and something that would be a good idea to practice at home for kids coming back to school soon. The next thing is to avoid close contact with others as best you can, to keep 6 feet distance from other people that are not in your household, that haven't been with you in your household. The next point is to cover your mouth and nose with a mask when you're around others. So just a couple things about mask wearing. So masks are designed to protect other people from you, not the other way around. And they're not a substitute for social distancing. So it doesn't mean that we can put a mask on and then, gather in a room closely with lots of people and feel that we are safe. So it's not a substitute. It's in addition to social distancing wearing a mask. Cover your coughs and sneezes, right? So when you do have to cough, sneeze, use a tissue, throw it away, wash your hands immediately afterward, and cleaning and disinfecting. So frequently touched surfaces, make sure that you're wiping those down, especially if you've been touching surfaces in public places.
Great, thank you.
Sure.
Okay, so again, all healthy hygiene practices, and we're going to just kind of be drilling this point home this evening. Stay home if you're sick. Recognize the symptoms, and prevention is critical. So that really is just a huge part of working together. So I'm going to start with the health screening questionnaire. So a lot of questions came up about the health screening questionnaire. So the health screening questionnaire will be provided to all families on behalf of the students and staff prior to school. So it's for students and staff. So there are families on behalf of their student and staff will need to answer questions every day prior to coming to school. The questions will be, and this is not the exact wording of the questions, but this is very close. Have you knowingly been in contact in the past 14 days with anyone who has been positive for COVID or has had symptoms of COVID? Have you tested positive for COVID in the past 19 days? Have you taken your temperature today? Is it or is it not 100 degrees or greater? In the past 14 days, have you had symptoms of COVID? There will be a list of symptoms provided as a reminder. So the answer will be yes or no. Have you had symptoms of COVID in the last 14 days? Have you traveled internationally from a state with widespread community transmission of COVID per the New York State Travel Advisory? There is a link here in this document to that travel advisory. It gets updated daily. States come on, states come off. So parents have to be aware if they're traveling with their children, it's possible that they will not be able to come to school for 14 days if that was a state on the travel advisory. So anyone who answers yes to any of the questions will be directed to either the school nurse or to human resources if it's a staff member. So any of those questions that are answered yes, parents that will be told they cannot bring their children to school, staff will be told you have to stay home and you have to make a phone call to either the school nurse or to the human resources director. And then there will be a process from there. So implementing this screening will be done building by building. Anyone who has not filled out the screening form will be provided with a temperature check. Any student who has not filled out this form will be provided with a temperature check and a follow-up phone call to the parent. So procedures for verifying compliance with the health screening may be different for elementary and secondary. And we're going to talk a little bit more about that. So prevention, as we talked about, prevention is, a big piece of entering back into school. So for staff, we're going to be providing professional development to all staff members. We have a training program that staff members have used in the past, and that's for a variety of different topics, school safety, child abuse in educational setting. That particular method has now four COVID sections that staff will be required to take. As well as that, we're going to be providing staff members information on recognition of signs and symptoms of COVID-19, training in preventative measures to help students with hand washing, wearing a mask, social distancing, cough etiquette, appropriate use of PPE, and health office procedures, which we're going to be talking about as well in detail because those have been revamped this year. Also, signs and symptoms of multi-system inflammatory syndrome in children, which is a very serious disorder and has happened in some children. So we are going to be doing a lot of training with staff as well as students. So students, we're going to be providing training when students come into school as well, training on wearing a mask, cough etiquette, hand washing, the same health procedures, disposal of tissues, bathroom use, how to recognize signs and symptoms in themselves and when to report them to a staff member, and social distancing. So all of those things we're going to be providing to students and staff. Training, education is going to be intertwined throughout the school day, and it's going to be ongoing. Okay, health office procedures. So we really took a very close look at all of the health office procedures this year. We went around to all the school buildings. We kind of revamped all the health offices because we wanted to make sure that we had separate spaces for students who had routine health conditions and students who were potentially ill with COVID symptoms. So if a student is not feeling well, they will notify a staff member who will call ahead to the health office. So a student, whether in their classroom or whether they're in the cafeteria or on the playground, there's people with walkie-talkies. Everybody's going to be trained in these procedures. So students will notify that they need to go to the health office, and a staff member will call down to the office ahead of time. And we wanted that process to be in place because we wanted the health office to know that a student was on their way. Okay, so what we did was we looked at each health office and we created kind of like a single point of entry triage area. So students who are ill will be sent to an isolation room for assessment or to an other room. So example, a student comes to the health office and they say they're not feeling well, they have a bellyache. The school nurse is going to bring them to a room that's called an isolation room. It's just a room where they're going to go with the school nurse for that assessment, and that room is for students that are not feeling well and have any of those pre-COVID type symptoms like a headache or a sore throat or a cough or a belly ache or whatever those symptoms might be. They will be assessed there. They will stay there. If the school nurse needs to leave that room, they will be monitored with either the health clerk or someone else. So they will always be supervised. So students will never be left alone in a room. So then, if a student comes into the health office with, a cut or a scrape, or they fell down, or they stabbed themselves with a pencil, any of the other reasons that kids come to the nurse, then they will be again assessed at that single point of entry, and they will go to the well room or the other room. That could be also for routine medication. It could really be for a lot of different things. So we're going to have just a separate procedure so that kids are always separate from each other, and they're not walking through another room. They're separate bathrooms that we have identified for use. Bathrooms will be cleaned after their use. So there's a whole protocol in place for this health office. Masks will be required the whole time, obviously, especially, they'll just be required, period. They're required in the school. So they are required. Social distancing will be practiced within the health offices as well. So obviously, if kids are sick, they have to go home. We want them to go home quickly. We're going to call parents. We need your help to pick up your child as quickly as possible. And they will be escorted out of the building and placed in your car. So we will bring students out. We will have them, get into your car, and that will be the procedure. I have a graphic organizer that I made for this that really talks about from the time, and you can click on this and get it, hopefully. It's also on our health reentry plan. You can click on it and sort of, I kind of did a whole graphic organizer from the time the student is ill, what exactly happens, if they're sick with regular routine, kinds of things, pre-COVID type things, when they can come back to school. There's a whole map on that because it's kind of confusing, and I like graphic organizers. So I thought that might be helpful. So we're going to go into a little bit about the return to school after illness. There's a lot that's new, so we really want parents to understand. So the bottom line is, in order to return after a student is ill, you must have a note from a healthcare provider. And we're going to go into what that looks like. Is there anything else that you wanted to add, Rebecca or Catherine, at this point?
No, I'm good.
Okay, just jump in at any time.
Okay.
Okay. So criteria for return to school if it's not a COVID diagnosis, okay? And just a reminder that everything has to be reviewed by the school nurse and or the medical director, so that it's not just that you can get a note and come back in. There's also a review and an assessment process. And we've thought very carefully about this because we want to keep everyone as safe as possible. So students may return when they're fever-free for 24 hours without the use of fever-reducing medications. And this is a big one. It has to be without the use of Tylenol or Advil. You can't, give your child Tylenol and send them back because their fever is a little bit lower. It has to be without that. And symptoms have improved and a student is feeling well, and there's clearance from a healthcare provider to return to school, and there has to be another diagnosis. So Rebecca, do you want to give an example of this? Like maybe it was a sinus infection, or maybe it was.
Sure.
you have more of those experiences.
Sure, exactly. So, I can think of kids in the fall with seasonal allergies, who the fall is a big time for them to have runny nose and a little bit of a sore throat. And if they are sent home for this, then we would just need a letter from the healthcare provider that these symptoms that the child's exhibiting currently are in line with their seasonal allergies, and that there's not a consideration of COVID at this time. Then that child, when they come back to school, needs to bring the note, and the parents need to check in with the school nurse that the nurse also feels that that's sufficient, and then they can return to class. So there's a little bit of an extra step to make sure we're maintaining the safest community possible at school.
Okay. All right, so the next would be if the return to school, if there were a case of COVID-19. So again, the review by the school nurse and the medical director. Now for this instance, it would be 10 days since the start of symptoms and 3 days fever-free, again, without the use of fever-reducing medications, and improvement in respiratory symptoms and a note from healthcare provider. So obviously, if you had a COVID diagnosis, it's going to be a different process.
And these are the CDC guidelines for returning.
Yeah, this is pretty.
We didn't make these up.
Yeah, CDC standards. Yes. Okay, so a recap. Every child returning to school after missing in-person class must have a letter from the healthcare provider. Letter and child needs to be reviewed and assessed by the school nurse and or the medical director prior to a child is able to return. So do not send child back to school with a letter before communicating. And if you think about that, most students are going to be in a hybrid model 2 days a week. It gives parents an opportunity to be able to, gather that information, call over to the school nurse, and then when the student comes back to school, all they would have to do is check in with the school nurse. We'll just give a little once over. How are you feeling? Glad that you're feeling better. Go back to, go to class, and, just to have that eyes on. And so that's what that will be. Anything else, Rebecca, to add? Or?
Just one thing to clarify here, that this is for students missing classes for a medical reason, right? If you're going on a trip or they have, a non-acute appointment, their physical or their dental appointment or something like that, this does not apply. This is kids who, missed school because they were ill and that was the reason for absence, or were sent home from school.
Right. Yeah. Yeah, there's going to be a lot of reasons that kids don't come to school, right? They may have a medical appointment. So yes, it's only for if you have a medical reason for not coming to school. Okay, COVID-19 testing. So there was lots of questions about whether we were going to be testing students or staff members. And I know that there was some confusion with the governor's office, who was indicating that school districts were going to be testing, providing COVID testing to students, and Eastchester, and I don't know any of the surrounding schools that are going to be providing COVID testing to students or to staff members. We do have a relationship with the Westchester County Department of Health, and we have information on our website under the health section where to get COVID testing. Your healthcare provider can provide, places for you to get COVID testing. I have 2 links on the website. One, you can put in your zip code if you live in the area, if you're a staff member, or there's a listing of testing sites within the area. Okay, contact tracing. So contact tracing is provided and conducted by the Westchester County Department of Health. So they will conduct contact tracing when they are notified of a confirmed test result by a doctor, family, or other entity. So, and the important piece here, it's a confirmed test result. The Eastchester School District we may notify them of a positive case. There could, because there are times that in the past that, parents would have called me or, the building principal to say, I was tested positive, or, someone in my family tested positive. So sometimes we might be the first person to know about it. And then we would call the health department. Regardless, the health department is going to need a laboratory confirmed test before they will come out and do any contact tracing. And we will assist the Westchester County Department of Health in doing that contact tracing. They're primarily responsible for that. They are responsible for the notification piece for the mandatory isolation or quarantine. So we will provide information for students as far as, phone numbers, addresses. We will provide schedules for students so that, and we will work very closely with the Department of Health in the contact tracing process. Okay, definition of terms. So I think Dr. Collins, you were going to be going into some of the definition of terms.
Sure. Okay, so just so we're all on the same page with all of this new jargon, contact tracing involves identifying people who have an infectious disease, cases, which in this case we're speaking predominantly about COVID, and people they come into contact with, which are called contacts, and working with them to interrupt the disease spread. This includes asking people with COVID-19 to isolate and their contacts to quarantine at home voluntarily. So these are terms that I feel like are thrown around a lot: isolation, quarantine, contact tracing, contacts, contact of a contact. So I thought it would be helpful to kind of walk through these. So quarantine means keeping someone at home who was in close contact with someone who had COVID. So someone has COVID, they have a confirmed positive test, and someone else was around that person. My child goes to school, someone in the classroom had COVID. With the discretion of the Department of Health, they may ask other folks in that classroom to quarantine, which means my child is healthy, but for 14 days, we're gonna keep her under wraps and watch for symptoms. Isolation means that someone has tested positive for COVID-19 and they need to be kept away from others, even in their own house. So if I test positive for COVID-19, that means that I have to stay in my house, in my room, if I can, with my own bathroom, until I meet those symptoms that are exactly the same as the CDC guidance for return to school, which is kind of return to life, which is until it's been 10 days since the start of my symptoms, and I've been fever-free for 3 days without the use of fever-reducing medicines, and my respiratory symptoms having improved. That's when I can leave isolation and rejoin the world with all these new practices, right? Still keeping a mask on, still distancing, still washing my hands, but I have to keep isolated even from those in my house. A contact, as we mentioned, is someone who has had contact with someone with a confirmed case. And then there's this contact of a contact. So I'm going to think of a good example here. So I see a patient in my practice who has COVID. So I've had contact with that patient. And then my family member has contact with me. They're having contact of a contact, right? In that case, there's really all of the CDC, WHO, all of the large academies on infectious disease advise we remain vigilant. We still keep a mask, still wash our hands, check our temperature, those kinds of things, but there's no additional steps that need to be taken.
Okay, thank you. Communication. So if there is a confirmed case of COVID-19, parents and the school community will be appropriately notified. So the Westchester County Department of Health will lead in the contact tracing and notification of mandatory quarantine or isolation of individuals. The district will work collaboratively to assist in this process, confidentially Confidentiality will be consistent with state and federal guidelines. It's going to be a team-based approach. It's going to be very individualized depending on the situations. So it's going to be a combination of working with the Westchester County Department of Health, working with administrators, working with our medical director, working with principals, working to really identify where the communication needs to be. However, there will be communication. That was something that parents were really asking about, and I would just want to make that clear. We will be communicating. School closings. So the Eastchester School District will use a variety of metrics to determine school closures. This could be increased absenteeism, increased illness, number of COVID-19 cases in the district, and infection rate guidelines provided by the state and region. So there's lots of different metrics that we can use for school closing. Okay, important considerations for making in-person instruction. So this was a slide that I thought was really important for parents to understand, because I was getting a lot of questions like, reading a lot of questions like, when will a student who develops symptoms of COVID-19 be quarantined immediately? So I really felt like I wanted to kind of outline the process a little bit. So if students or staff may develop symptoms of COVID-19 during the school day, right? So we have a screening process. We have kids wearing masks. With all of that said, could a student or a staff member develop a symptom of COVID during the school day? Yes, right? So we have a process in place to isolate and send home that individual. So COVID testing may take approximately 2 to 7 days to get the results. So for example, a student could have symptoms on Monday, be sent home. The healthcare provider could get a test for that child, and then that test result may not come back maybe Wednesday, maybe Thursday. So student has symptoms on Monday, test results come back maybe Wednesday, maybe Thursday, if I don't know the exact time frame. So at that point, when I had talked about earlier, when there's a confirmed laboratory test of COVID, that's when the contact tracing will take place. So student could get symptoms on Monday, and then we could be working with the health department to quarantine individuals later in that week. So that's when the notification process will happen, because we won't know that a student has COVID until we get the test results back. And I just wanted to make that clear to parents and to family members that there is going to be a lag between the onset of symptoms, a potential diagnosis of COVID, communication with the Westchester County Department of Health, and then subsequent communication and notification to families and school community. So I really just wanted to give those examples, because it's not, that the student has COVID, I'm pulling them out of school. They're most likely going to be out of school already, because if they have any symptoms of COVID, they're going to be out of school, and they're either going to be tested, they're going to have another diagnosis to come back in. So I just kind of wanted to make that clear. I hope that that was clear, and if anyone has any questions about that. Rebecca, anything else to add?
Yeah, I think, this is a really tough decision for parents, myself included, to decide whether to do all remote or hybrid model. The CDC does have this back to school decision checklist. This is a hyperlink here, but you can easily Google it too. And it goes through a lot of things to consider when you're thinking about the risks and benefits of in-person versus virtual instruction that I found helpful. I think there are unfortunately delays in making this diagnosis. There's also a delay in when we know that folks are contagious, right? So an important thing to think about, I think, while you're making this decision is that even folks that are symptomatic, patient, staff members, teachers, students who do have COVID are contagious 2 days before they have symptoms. So even when we do identify symptoms, right, and then send them home, or they're kept home by their parents and guardians, and then get a test, and then test results come back, which can be 2 to 7 days, depending on how overwhelmed the labs are in Westchester County. Right now, the average is about 4 to 5 days, but there are some people that are waiting 8 days to get results. That in this lag time, we can't be sure where diagnoses will fall, so that there is a known risk to being with others, and we're doing as much as we can to keep a safe environment for our children. That being said, we're still in the middle of a pandemic, and this decision really has to be a personal one about what kind of risk you're most comfortable with.
Okay. Okay, again, just we need your help. We're a community that care, and we can slow the spread if we work together. So, and that's why we really put in a lot of these extra measures of, getting documentation and, really just looking at all of the students' illnesses, and really like breaking that down to that granular level of like what is going on with that child. And then let's get that documentation so we can kind of figure that out. All right, so I have a couple of other questions. Will all students suspected of, and this was one of the ones that kind of prompted, this was one of many of questions that prompted that slide about the 2 to 7 days, because I don't think it was clear to community members. I think it was kind of, I was getting the impression was like, as soon as, like a student has the symptoms, that we're going to start quarantining kids, and that is not the case. So I just wanted to make that clear. And again, this question kind of exemplifies that. Will all students suspected of COVID-19 be tested? And, will quarantine begin immediately? If a student is suspected to have COVID, they'll have symptoms of COVID. Will they be quarantined immediately? No. Like we talked about that process of the 2 to 7 days, and any child who is suspected of having COVID-19, they're going to be sent home. They're going to be asked to get a note to come back. We're going to be communicating with the parents and suggesting COVID testing. Parents can go and get COVID testing on their own. They don't need to wait for a healthcare provider to get the testing. There's other sites that parents can go on. And again, the Westchester County Department of Health will only come in and do the contact tracing once a student has a laboratory test that indicates a positive case.
Maureen, I just wanted to say one more thing about testing. Sorry to jump in. I just wanted to clarify, because I'm sure that some of our community here has heard about the rapid testing, and there's been saliva testing in the news recently. So currently the rapid tests available are about 80% sensitive and specific. And those, can be done in the room, 15 minutes, 30 minutes. There's a whole slew of products out there. But the tests that are much more sensitive and specific in the high 90s are the nasal swab or the oral swab, which actually being sent to the lab to analyze. So that's kind of why we gave that time frame.
Okay. If a student is negative for COVID test or not tested for COVID, will the healthcare provider need to provide a diagnosis other than COVID? Yes. So we will need, We will need healthcare providers to provide those notes. I did talk to Dr. Collins about that. I said, do your colleagues know that that everyone's going to be requesting notes from them? And she said, yes, we know that, and we will have them ready for them. I said, okay, great, because that is an important consideration. Have the health criteria for students who attend in-person instruction been updated? I thought this was a great question, because not every student that comes to the nurse's office with a so-called symptom of COVID necessarily has to go home. So what we're going to do is, obviously, if parents answer yes to the health screening questionnaire that their child has symptoms, they will be instructed to keep them home and call the nurse for further instructions. But there could be something else that's going on with the child, and that's where, taking a history and, Catherine Sullivan, you could probably talk a little bit more about this, and being a school nurse. If a student develops symptoms during the day, we'd have to take into the account, the school nurse will take into account a student's medical history. They'll contact the parents. They'll ask for more follow-up information. What's going on with the student? Maybe a student came to the nurse with shortness of breath. That's one of the symptoms of COVID. But then after contacting the parent, looking at the medical records, the student has a history of asthma. Maybe it's not a recent history, maybe it's a previous history, and contacting the parents, that's a student that doesn't need to go home. So I don't know, Catherine, if you want to talk about some of those instances that you come across, on a day-to-day basis in a school setting.
We take all that into consideration and we also know the medical history of the students before they walk into our office. We have their charts, we have their physical forms. So we are familiar with their histories, but we will call the parent and, review if there's a problem.
Mm-hmm. Thank you. Okay, how will students wear masks all day? And what will be the ramifications of not wearing a mask? So there were a lot of questions about masks, and students will be required to wear masks throughout the day, whether they're in the classroom, the hallways, larger gathering spaces. So teachers will work with students to take mask breaks throughout the day. That could be in the back of the classroom, it could be out in the hallway, it could be outside. It's going to be a case-by-case basis, and the teacher of the students will come up with a plan on how students can, comfortably take mask breaks and, using social distancing. Teachers will work with parents and support personnel to assist students through this process. So we can do lots of things to help, kids wear masks. We can for younger kids, we can have them play games. How, everybody that's wearing a mask has to kind of guess what you're thinking from your eyes. Maybe for the younger kids, they can play games. Let's guess what I'm thinking. Let's put our masks on and think, what's the other one's emotion, so you can, intertwine, emotion recognition and, all kinds of good things. Maybe, having a pizza party, for the class that wears the mask most of the time. So there's lots of things that we can do to help students wear masks, to help students feel comfortable wearing masks, to support them in that process. And we're just going to work together to make sure that that happens, because that is one of the safest ways that we can protect each other. It's thundering. I can hear a lot of thunder. Will social distancing take place in the hallways? Yes, social distancing will take place throughout the school in all areas of the building. Teachers, teaching assistants, monitors, administrators will assist students throughout the day. We will be reminding students, trust us, we will be talking with students, we will be reminding students. There'll be processes in place, there'll be arrows, for summer school, we had arrows, we had waiting lines, for all the bathrooms. We went through the entire school for drop off, for pickup. We had spots where people were standing. So we're going to come up with lots of creative ways to help students social distance. Will my child's temperature be taken before school? So this is where we need your help for parents. Parents should be taking their temperatures, the students' temperatures, or older students should take their own temperatures before starting school. If a parent neglects to fill out the form, forgets, for whatever reason, we will locate the child and take their temperature. We are looking to do this prior to a student entering the building. And that is a process we're putting in place now. Like I said earlier, we're looking at different apps and different ways that we can do this. And that's going to be a little bit different for younger kids versus older kids. And that's all I have as far as the PowerPoint, but any questions, I could stop sharing and any other questions. I don't know any other comments, Rebecca or Catherine, prior to any other questions. No.
Thank you, Noreen and Catherine and Dr. Collins. We really appreciate you putting that together based on the questions received so far. And we have had a number of questions come in. I'm wondering if our board member co-host could help pose some of those as they're being grouped and looked at.
Well, maybe we could just start with where Dr. Urso ended, which was on the reporting of temperatures. So you mentioned an app. So you are planning, the district is planning to do this reporting somehow electronically, correct? Not a paper form.
Right. Yeah. It's
There
going
were
to be,
I can jump in there because
Okay.
we've had extensive discussions on this. So there are a number of apps available to do this. Most of them provide an ability to use a phone to, show a red or a green screen with or a certain color screen on a certain day, so that students walking in can show that to the people manning the door. If they don't have that, then we would stop them and and ask, what if it had been done, could they provide the documentation? We're looking for also an app that would, as an alternate for younger students who may not have a phone, where it could be done via paper. So those would be the two methods that we know of at this time. We also know that most of these apps can provide a push notification to families. So if we can send that a couple times, maybe like an automatic one at 6 a.m., another one, depending on the level, just before students are getting ready to maybe leave the home, that would give a reminder. And then it would generate a report that we could look at prior to the students actually coming. We would know who's neglected to complete that form. And the challenge is, though, we would like to be able to catch those cases, before they enter the building. And the only way that we know to do that right now is through a phone app that would either give you a screen or that would give you an ability to print. We'll continue to look for solutions. That make it a little bit easier. I understand that the printing could be burdensome for some families. We think that perhaps even students as young as down to maybe second grade could, if they have phones, for that purpose, could use them and then deactivate them and put them away when they get to school. But that is the preferred method because it doesn't use paper and it would give us a quick read, and we will take temperatures, as was noted, for anybody who, and we'll contact the parents. And I just want to say that we looked hard at trying to do this ourselves and take this burden off of families, but the technology is very difficult to get installed and trained and have it be accurate and not bunch people up, not cause a crowding. We've looked at a lot of different pieces of technology, and in the end, what we've come to is, look, this is a community responsibility. We've got to be vigilant for one another, and none of us can ever let up. So we're going to do our part and catch anyone who didn't take care of it, but we really need everybody's help. It's going to be very important that all families do this every day, just as employees have to do it. I've got to do it every day before I come in, now, and it is a new normal, and we're going to have everybody do that. And if people don't, then, that's the whole foundation really of all of this, right? All of this starts with personal responsibility, and for the greater good, for the good of the community health. And if we just have to help each other. We just have to.
There was a couple of questions that I saw about students with special needs and how are we going to, they're not going to be able to show a phone, or we will be taking your temperatures. We did that all summer. That is what we had in place for the summer. We took all the temperatures of students with special needs who couldn't show a phone. I mean, we wouldn't expect students with special needs to show a phone. If the student doesn't have the verification, we will be taking the temperature. We will get a list of students and we will get your temperature taken if need be. So we will definitely work that out. You don't have to worry about that.
Yeah, we can do that with handheld thermometers at the door, yes.
Yeah, we have the touchless ones. They work really quick, they're fast. Also, there was a question also about special needs and wearing a mask. We know that, some students do have some difficulty with masks. I have to say that in summer school, the students that came, I was expecting students to have a lot of difficulty with masks, and they really stepped up. They wore the masks. They did great. We were so proud of them. It didn't take very long to help them, to work with them to wear the masks. There's different things that students can wear. There are face shields. There are hats that have a face shield. So there's lots of different options that we're working through with parents for some students who have more difficulty with masks.
You touched on something, Dr. Urso, that came up also, was a few people asked if it was specifically masks, if face shields were allowed, if there were discussion in the news recently about gaiters, if there were any guidelines about what will and won't be considered a mask.
Right. Well, right now, the wording in the documents that I've read is face covering, and it's a cloth face covering. That is the requirement right now. If the district wants to move to something else, that's different. But right now, the requirement is a cloth face covering. I did hear about the gaiter thing.
Yeah.
And
there were also some. I'm sorry.
Yeah, while we're on the topic of masks, I just want to mention I did see a question flash about who's providing the masks. We are asking families to go ahead and provide cloth masks, but we will always provide a mask to anyone who doesn't have one or needs one. If there's fails, if they forget, if it becomes soiled, we've ordered 250,000 masks, and that's just for starters. That will not get us through the year, but that's all that PPE is ordered, and we'll have them handy, available in the classrooms and in the offices, for anybody who needs one.
I know there's still a lot of questions about masks and specifics about masks, and I just want to reassure people that the building principals will be looking at every student in their classroom to work out the details of taking mask breaks. We want students to wear masks as much as possible. We're hoping that is the case. Can I say for sure that students are going to be wearing masks all day long until the designated, mask break? No. We have to be realistic about what children are going to be able to do and what they're not going to be able to do. We are going to work with them. Principals will work them in the whole school building. I think that they are going to rise to the challenge. I think many students are already wearing masks in the community. They're used to it. And, we will help them to wear masks.
I just maybe follow up because I see this coming in from a teacher. So I want to elevate it. The question about monitoring students as they enter the building. Is it real? They come in large groups. Is it really possible to find that student before they enter the school building? If they didn't fill out the daily health questionnaire, how do you ensure that the students aren't slipping by? And maybe
I'm going to jump in on this one. We're going to post 2 people at every door. Okay, so 2 people will be at every door, and we're going to remember you have half the density, so you have half the number of students coming in, and we'll be watching and training them how to come in more in a single file nature. At the earlier grades, you see that to some extent, but at the later grades, that's going to be a retraining process that we'll have to do that. But you know, as I said, they're either going to have an app or they're going to have a piece of paper. If they don't have that verification, they don't get in the building, right? And then one of the two will, will take that child and, find out how we can help them get the verification. We can certainly take their temperature on the spot, right? And that's a big part of it. That's not the only part of it though. Those other questions are really important. We need to know if they've been around anyone else. So, and as Dr. Collins mentioned, and there are some asymptomatic cases. So taking temperature, it is important, but it is, only to a point, right? And this is a parental responsibility. We looked at scanners. I was going to mention this because a question flashed. Have we looked at the scanners? Yes, they're exorbitant, and we can't get them in time, and we can't have them in the training and the calibration and all that goes with that. We're just concerned it's going to cause backups and magnify the social distancing issues at the school entrances. So we're going to do it by hand, and this is our process. And that's how we're going to start. If we can find a way to get kiosks and other things that are accurate, reliable, don't have calibration issues, and can help with that, and we can do it cost effectively, fine. But some of these items are like $25,000 per, and they look like metal detectors, right? And if you've got 2 or 3 entrances at 5 different schools, it is a lot bigger issue to do. So this is how we'll handle it for now.
Is there any special training now? This might be for Catherine Sullivan, for Dr. Urso, Dr. Collins, special training on, keeping children calm. If you do identify a child who's coughing, or the teacher wants to send the child to be checked, these are scary times. So are you having any special training into keeping the child calm and not going into, immediate emergency mode with the child?
Well, certainly there's lots of training to help students to manage their emotion regulations. We have lots of mindfulness activities in the buildings, especially for young children. I know many of the buildings incorporate that into the school day, and there will be opportunities for students to be able to practice those skills, so that if, that can be something that's prevented. Kids do really, really super well with some of the mindfulness activities and breathing activities. So sometimes just simple breathing can be helpful for a child to just calm themselves down. There's specific types of breathing that are actually physiologically helpful for students. I don't know, Catherine, if you have any strategies when students come in and they're upset.
I think it all depends on the child too. Every day we have kids that come in that are upset, not just for illness. And I totally understand your question. Do all kids think they're going to have COVID now when they have a runny nose or they're coughing in class and everyone's starting to get nervous and they're calling the nurse and sending them to the office? But I think the teachers are very good. That's always the starting point in the classroom or wherever they are, the monitors. I think everyone is very good with the children. And for the most part, people try to remain calm and talk to the kids. And I think that we all just operate that way. Even when they come into me, we don't ensue panic and fear, and we always try to just maintain calmness. So I really think we'll just continue to operate that way. But I totally understand the question, because there is more, it's more stressful now. Kids think they're going to get sick. But for the most part, kids know the staff also, which is nice. They're familiar. We have the new kids, the second graders coming in. But I think overall the staff is very good, and we'll just continue with the calmness and reinforce it with the staff and, each other. And I don't know if that helps, but.
Yeah. We're also going to do some extra professional development the first couple days. As parents know, we push back the start of school for a couple days, so there'll be some extra professional development that we'll provide to all staff to not get super anxious about this, right? Because that would work against us. If we had a message of just crazy anxiety every time someone sneezed, right, then that would disincentivize students to tell the teacher, like, I'm not feeling so well, I think I have to go to the nurse, right? So we'll be working with our whole team to make sure that students and staff feel comfortable when they're just not feeling well, and to answer those questions, as appropriately as I can.
Since it seems it'll be increasingly important to have real good communication with the school nurses. For instance, when children are out, you want to clear them with the nurse before you send your child back with the letter and all the other documentation. Has the district already, or will the district kind of elevate nurses' contact information somewhere on the website, so it's really easy to find how to contact, who's the person to contact when I want to send my child back to school or I have a question?
Yeah, it's right on the health section now. Every building is listed with the contact information for the school nurse on the reentry plan under the health section. All the nurses' email and phone numbers are on there, I believe.
There were some questions too about procedures for notifying parents when there has been a confirmed diagnosis of COVID in the district, in the school, and in a specific classroom. Are there procedures in place for notifying parents with confirmed cases?
Yeah, so we will definitely be working with the Department of Health if there's a case in the student's classroom. I certainly would suspect that everyone in that classroom will be notified. And as far as the larger school community, that's something that we're continuing to talk about. I don't know if Dr. Glass has some thoughts on that.
Well, typically, I mean, we're balancing the need of, for student privacy, right? Privacy laws that protect the names of students and the identity of students. And we're balancing that with the need for community health. So typically what we've done is you would know if there's a confirmed case, at what school and at what grade level. That would be, typically what we would do. We're not going to give you the name of the student, and we're going to, and then if certainly anyone who was in that classroom through the contact tracing procedure, anyone who is in contact is going to be contacted directly and, given instructions about what to do and so forth. So, I mean, that's the way we're handling that notification at this point.
There were some questions about, can teachers break the 6-foot social distancing barrier to comfort a child, to do some sort of instruction, to tie a shoe, to help out with a coat? What are the rules on that?
Yeah,
Well,
I would say
go
yes.
ahead. Yeah.
I would say yes, there has to be. I mean, I don't know how we would function as a school district if there weren't, some opportunities where you would have to interact with children.
Yeah, there's a lot of teacher discretion, right? Also in these situations, and it would vary at grade level and also for individual teachers.
When teachers come in closer contact with students, they can wear face shields. So if there are specific times where they have to come in closer contact for whatever reason, teachers can wear masks and face shields.
There have been some questions coming across about going back to the procedures for the initial identification of a student with or a faculty member with COVID. No, I'm sorry, to a student with COVID and coming back to school. First of all, there was some confusion about a 10-day isolation versus the 14-day quarantine. So hopefully you can expand on that a little bit. And then also about on the return, if it turns out that a doctor did not find it to be COVID, found it to be symptoms of something else, just verifying that you need a note. Do you need a COVID test? What verification will be done by us at that point? And then the last question in that group of questions, is maybe I'm going too many, so I can repeat them, had to do with with students who have like allergy symptoms that are chronic and, runny noses that are chronic. Are we expecting them to go home every day the pollen count is high? So that was the series of questions that related to that. I don't know if I went too fast.
Well, I can talk about the 10 to 14 days. So the difference there is between quarantine and isolation. So for isolation, meaning that we have a documented positive COVID test, that person who was tested positive has to be in isolation for 10 days since the start of symptoms. For quarantine, meaning that someone has been in contact with someone else who has the positive test, it's a 14-day quarantine. And that's to make absolutely sure that they don't start developing symptoms themselves. The CDC, WHO, and other, the IDSA, Infectious Disease Society of America, has shown that once you're tested positive for COVID, 10 days after those start of symptoms, and being a fever-free for 3 days, and your respiratory symptoms have improved, that the ability to infect someone else is nil. So that's why those are the two. As far as, I'm remembering the third question now, about typical symptoms, you have a child who has allergies, the nurse knows it, the parents are familiar with it. That's why that's why communication with the school nurse is gonna be so important, right? Oh, I remember the second question about a confirmed diagnosis other than COVID. Are we requiring a negative test? And that's no. Now, there could be some different cases there, right? So someone who has a fever and a sore throat and
Cough.
yeah, fever, sore throat, coughing, that's pretty and vomiting, and they can't smell. Okay, we'll just do a case like this, right? And they go to an urgent care, to a provider they've never known before that says not COVID, return to school, right? And the nurse sees the child come in and the child's still not looking 100%. They may say, you know what, I'm not feeling comfortable with this. Let me talk to the parents again. I may strongly suggest that you get a COVID test, right? So that's why we're doing all this. We're trying to keep sick folks at home, whether or not they have COVID, and well kids safe from those who are not feeling well.
There are a lot of contact tracing questions that I'm seeing, and that can get very complicated. And I don't want to misspeak for the Westchester County Department of Health. The only thing that I could say is that, some of the questions were, if they're in areas where there's lots of different children, like if there's a student that has a positive case that's on the bus, or if they're in a gym, or if they're in a lunchroom with different, who's going to be, quarantined. All I can say is if the health department can't determine who's in quarantine, I would think that bubble is going to get wider. So, you look at the term proximate contact they're in the area. They may not have had close contact, but they're, in proximity to an individual. And on the reentry plan, which was updated, there is something from Westchester County. There's a document from Westchester County that really goes through lots of scenarios of contact tracing that you can access on the website and kind of familiarize yourself with these contact tracing protocols. So, that's what I can say about that. So, if you really can't determine in that smaller scenario who to quarantine, I believe that net will get wider, and that more people will be quarantined, or potentially a school building would have to be quarantined if we can't determine that. Then there was a good example of a question of a contact where if a student has, let me see if I remember it because it's gone. If a student has COVID and they have a sibling in another school, will they need to be quarantined? So anybody in the household, I'm thinking, would be quarantined, right, Rebecca?
Yeah.
But not necessarily everybody in that student's class. So the question was, would everybody in the brother, say it's the brother who is at Greenville, but the students who has COVID, Waverly, will everybody in the Greenville class also need? That's an example of a contact, correct?
Yes.
Right.
Yep.
So that
So
was
the Waverly student would be in isolation in their house as much
Right.
as possible, right? Because they're
Okay.
5, maybe isolation with a parent.
right.
And the rest of the family would be outside of that room. And then everyone else, right?
And then anyone who was in contact with someone who's in quarantine, unless that person had symptoms, then that might be a little different, right? If the
Right, it's still contact of a contact, and we do routine
Right, so-
masking, distancing, hand washing.
Yeah, so it can get really tricky, but be rest assured that we will be talking to the Westchester County Department of Health. We will be calling Dr. Collins. We will be making sure we cover all bases if there is a COVID case, and hopefully there will not be. But we will make sure that we follow every procedure. We, look at everything and communicate that clearly.
I saw a mask question come through for the health professionals. Should a student have a mask, like switch masks after 3 hours? Don't they get dirty and germy if you wear it all day long, 6 hours? So would you recommend that children have their AM mask and their PM mask?
That's an interesting question. So as a health professional, treating many cases of confirmed COVID, I keep my mask. We just don't have enough to use different masks throughout the day when I'm seeing people with COVID that I know have COVID because they're too germy. So without evidence at my fingertips, and I'm happy to look it up and send it out, I think one cloth mask a day. I think taking appropriate precaution would be to wash that one, to buy a few. And I think the Waverly principal, Ms. Doyle, sent out a request for kids to have a couple spare masks in that case that they eat and they get dirty, or they're on the playground and it's muddy and that kind of thing. So I'm guessing at individual school levels, they'll have a procedure to have some extras, but to mandate a certain amount of hours, again, keeping in mind that we are not filtering COVID through the mask, right? You're protecting others from you. So there's a difference in why we're masking, right?
I believe that Waverly might be asking parents to bring in a morning and an afternoon mask. I don't know if that's where that came up. I believe that's the case. One suggestion would be for parents to put, bring a Ziploc bag with their name on it. So if the student wants to take it for a mask break, if they want to put it in a clean place, they can keep it clean.
There was one.
That was an idea as well.
Oh, I'm sorry, I didn't hear that. There is one small study that came out at the beginning of the pandemic to show that actually mask breathability is better in a paper bag than a plastic Ziploc bag. So that could be something that we consider. There was a small study that showed that. So on days that I am not in the office wearing my N95, we store them all in labeled paper bags. It breathes better, kills viruses easier.
There's questions about students coming home from college who are quarantined, who are from other states that were on that list. My understanding is only that student needs to quarantine, not the whole house needs to quarantine. Similarly, if you have a student that is in a family where the parent traveled to the state and comes back to that family, only the parent has to quarantine, not the child who lives in the house with the parent who traveled.
There were a couple of questions also.
And yeah, that's on that CDC document. That exact question is there.
There were a couple of questions also, it came up in the chat and also privately. If a student does get sent home, has to be home for a period of time, and this may not be exactly the right audience, but it is a question. Do they immediately go into like the remote group and they dial into their classes? Is that the vision?
Yes, if the student is home on quarantine, they would be able to access virtual instruction.
Thank you.
Yeah, the question had to do with a penalty, like an attendance penalty. I mean, no, if they're being home for, we're asking parents if a child is showing symptoms, right, don't send them. And so we're going to be pretty liberal on that because we obviously have a way to deliver instruction now that's robust for home.
There was a question about masks that are easier to breathe in. I personally find the paper ones easier to breathe in than the cloth ones, but I think you could try them on and see what you're thinking. It might be just a personal preference.
Yeah, I mean, there's a great variety for kids out there. The cloth, homemade, some of the like polypropylene, like real stretchy material. So I think just trying those out in the next couple of weeks before school would be appropriate. Also, there's different ways that, some kids, adults too, right? You can get sore behind the ears. So some of them have the tie in the back of the head. There's all kinds of different ways to do this. So those would be things that I think would be helpful to work with the students before school to find out what was most comfortable for them to wear for an extended period of time.
There's still a lot of questions about the screening, and I think we definitely will be, we definitely will be putting out more specific information about the questionnaire.
The questions that we will be asking though are in the FAQs on this topic. And so you'll get, those specific questions are already available. And that's what will be on the app. We're just in the final stages of trying to decide which app we want. We're down to 2 of them. And once we know that app, we'll provide that too. But yes, it'll be pushed out notifications. The questions will be easy for you to attest to. And you're just going to be asked to attest that you took a temperature. We're going to need you to do that. And then the student phone would, where we're still kind of working through the app is to figure out, if you push the notification to the parent's phone, how do you get the notification on the student's phone? And so we're trying to work some of that out. But bottom line, printing, the attestation, hopefully it's just a small piece of paper and it's something you can do readily. And that's kind of the key if you don't have the phone. Don't try not to get too hung up on the phone. We're trying to make this simple. Don't go buy a phone. Well, if you don't have one, and especially for young children, we understand that. We're trying to finalize that system, and it sort of depends on the app we choose. We can give you more distinct information at that point.
There was questions about lockdowns during social distancing. We will still be doing lockdowns. Drills.
Fire drills and lockdowns are continue to be mandated by the state, correct? Do you have any information about how you do those while maintaining social distance, or?
You're muted still.
We will we'll be working with our security consultant firm to get a little bit more specific on that. That's a real conundrum, frankly. It's some mutually exclusive things going on there. Stay socially distanced, but get out of the building quickly. I think that for fire drills, we're going to be asking students to file out in an orderly fashion in a socially distanced way. We realize it's going to be slower, but what's important is that they know the exits to go to, right? So the modified drill will be, it might even be staggered by hallway when the alarm goes off. There may be certain hallways that go first and it's just going to take us a lot longer to get out. But again, the idea is if there's not a real fire, it's important to know where to go, and the speed in this case is probably less important than maintaining the distancing. When it comes to lockdown drills, in a situation where students would be, maybe going into a small space in the classroom, we're just going to ask that they not do that. We're going to direct them what they should do in this situation and actually have them maintain the distancing, do as much as we can while maintaining the distancing. But there may be some tricks that we can learn to make that a little more effective. But it is a bit of a conundrum right now, but we're going to do it the best we can.
That goes back to a question that was asked earlier that's sort of related, which is, are we looking at changes to the dismissal procedures to accommodate social distancing as well? Pick up and dismissal.
Yes, all of those routines and procedures are school specific, and you'll hear more about that when you talk about when we have this individual school sessions, because it's all very different. You heard some of that, I think, in Josh's presentation at the middle school the other day too. But at the high school, for example, in the middle school, we are separating and adding entrances, right? So currently or last year, all students at the high school and middle school went in one big entrance. The buses will be stopping and dropping middle school students off. They'll be going in the middle school front entrance, which they've not done before in recent times. And the high school students will be coming in to the high school main entrance. We'll also be opening up an additional entrance in the back and a separate middle school and high school entrance in the back to try to distribute that. And then we'll be teaching and training how to do that while maintaining distancing. We don't think that parents are going to need assigned times. We thought maybe they would, but we don't think at this point that they will. So those are some examples from the secondary level, but the same things will apply. And especially I know at Waverly, it's been a very, it's a very tight space. And I know we're going through very detailed procedures on how to make changes. And we're looking at some novel approaches, and we'll be informing you of those as we have the Waverly session coming up on the 25th, I believe.
Just going back on the list of questions from the earlier on in the notes, a couple of folks asked just to confirm that the staff, we talk a lot about the kids having used the app, the teachers and the staff will also have procedures that, if not identical, are very similar, correct?
Yes.
Identical.
And the sanitizer that is provided at school meets CDC guidelines for killing COVID. There were questions about that. Should students bring their own supply? No. Okay.
We have additional, every classroom will have installed its own dispenser with 70% alcohol solution. Even hallways, there's been a slight modification allowed under the fire code. Used to be you couldn't have alcohol sanitizer in hallways. They're now allowing it near the doorways, but not deeper in the corridors. But even the solution that we use deeper in the corridors, while it's not alcohol based, I think they've discovered now that that's pretty effective against COVID. That's just as effective. So we're placing sanitizer stations all over the place. Mm-hmm.
Okay, great. Well, it's coming up on 9 o'clock, so we are almost a half an hour over time. There's been lots of questions and lots of questions answered, but we will continue. We're preserving all these questions and incorporating anything that hasn't been answered into the FAQs on the website, and posting all of the PowerPoint presentations and these recorded sessions on the website as well for your reference, and information will continue to be shared.
Yes, I just wanted to thank everybody for their time. Every panelist, thank you so much. Every family. I haven't looked lately, but we still have 380 people on. We had around 450, I think, at a peak, maybe more. It was terrific to see. I know this is stressful, and I know this is challenging for everybody, but I am so proud of our community, the way everybody's pulling together and seeking to understand, and is acknowledging how hard we're working to try to provide information. I wish sometimes I wish there was a way we could implant all this information, directly into everyone's consciousness, but the best we can do is what we're doing. And you're also kind to acknowledge that. And I'm sorry we can't seem to get to every single question. And even with our emails, we're getting a lot of email, and we're not always able to get to every single email in the detail we would like. So what I would recommend is we're trying to make that website the one-stop shop for you. It is very robust. There's a lot there, and we just keep adding. So if you checked the other day and you didn't find something, I would check it again, tomorrow and see what's there. And I know many of you are trying to make decisions. We've asked for you to kind of by tomorrow morning, please let us know if you're going to opt into the fully remote version. I know that's a high stakes decision for you, and I acknowledge that. I want you to know that if there were a way to get you this information faster and not put you in this pressure bind, we would have done it. But we're just, moving as quickly as we can, and we really need to get planning. So thank you for understanding that. And if in doubt, do what feels safe and right for you. Go with your you've got a lot of information here. I think one of the takeaways from this is that, you know, we talked about the lag, and you know, there's, as hard as we're going to work to make this very, very safe, it is an individual decision, and there are no guarantees of perfect safety anywhere in the world, including in school. So if safety is your highest concern, you know, consider the fully remote option. But you know, I think either way, you're going to get a high quality experience. You're going to get an experience that is a lot more robust than what you experienced in the spring. We've had a lot more time to plan and practice and train and put things into place, from schedules to procedures to attendance to, you know, teachers being more proficient with the tools, and having had some time to live through this once and to put new things into place. Okay, so I just wanted to take a few moments and share some of those thoughts that are uppermost in our minds, I think, at this time. And I wish you all the best. Are there any other thoughts any of the panelists want to share before we wind up tonight?
Have a great evening, and any questions, you know, please feel free to reach out. We're really working hard for your children, and if you have any questions, you know, we're happy to get back to you.
Okay. Thank you, and have a great evening, everyone. And I wish you a terrific rest of the week. Thank you.
Good night.
Bye.
Bye-bye.